Hi, everybody. Welcome to our talk on Ayurveda and ADHD. I'm Megan Hayes with Megan Hayes Ayurveda. And thank you so much for joining us, whether you're joining live or watching the recording. And let's go ahead and get started. So let's start with what ADHD is. It stands for Attention Deficit / Hyperactivity Disorder. And when I was growing up, it used to just be ADD. And since then, they have added sort of a secondary component to it, or a different way that it can present itself for different people. And according to the CDC, ADHD is one of the most common neurodevelopmental disorders of childhood. And we're going to be talking about ADHD for children and also for adults, because the treatments are very similar, but there's some modifications that you would obviously make for children and for adults. And so when I see that definition, neurodevelopmental disorder, what does the term neurodevelopmental mean? Because maybe you're not familiar with that term. Neurodevelopment is a term referring to the brain's development of neurological pathways that influence performance or functioning. So intellectual functioning, reading ability, social skills, memory, attention, or focus skills, right? And so these are the things we think of when we think of the health challenge or diagnosis of ADHD, attention deficit hyperactivity disorder. And ADHD is usually first diagnosed in childhood, and it often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors. They might think, or rather act without thinking about what the result will be, that impulsive behavior, or even just be overly active. And that's where the hyperactivity comes in. And so some of the signs and symptoms for ADHD in children are daydreaming a lot, forgetting or losing things a lot, squirming or fidgeting a lot, talking too much, making careless mistakes or taking unnecessary risks even as they get older, having a hard time resisting temptation, so impulse control, having trouble taking turns, so impatience, and having difficulty getting along with others, which can come out of those frustrations around a lot of the other symptoms. And it's really normal for children to have trouble focusing and behaving at one time or another. But children with ADHD don't just grow out of these behaviors. The symptoms continue, they can be severe, and they can cause difficulty at school, at home, and with friends. And so if you've studied Ayurveda, or you've worked with me in Ayurvedic health counseling, or you've listened to a lot of these lectures, you might recognize that all of these symptoms are Vata type symptoms, Vata dosha. And Vata is one of the 3 doshas in Ayurvedic medicine. And the doshas are physiological forces that govern nature, ourselves, and everything in the known universe. And the Vata dosha is made of the elements of air and ether. So Vata dosha is the coldest, the lightest, the driest, and the most unstable of the 3 doshas. We are all born with all 3 doshas in different ratios. That's what makes us unique. Someone who has a great deal of Vata, and Vata, in case you're unfamiliar with some of these terms, Vata is spelled V as in Victor, A-T-A, Vata. So someone who has a great deal of Vata in what we call in Ayurveda their constitution, they will naturally be more cold, light, dry, and unstable in their body and in their mind, and especially in their mind and the nervous system. So this means they tend to have physically thinner and more delicate features, bodily tissues, so thinner skin, thinner bones, thinner hair, thinner nails. They tend to have troublesome digestion because of all of that air and instability. And that can present itself as excessive gas, bloating, constipation, or irregularity. And due to the light, quick, and ethereal nature of the elements of air and ether, which make up Vata dosha, these individuals tend to have a very creative mind, but a lot of trouble focusing. They could also be quite, back to being creative, but having trouble focusing. This also can lend itself to having trouble finishing projects, making decisions, and seeing a clear course of action. There are just so many possibilities because they have so much creativity. And they could also be quite fidgety due to that mobile nature of the air element. Air is unpredictable. Air is also called wind. The word for air in Sanskrit, the term used in Ayurveda, is vayu. Vayu means air and also wind, right? And the wind blows to and fro, is very changeable. So there's a very changeable nature to people who have a lot of Vata. They change their mind very easily. It's hard for them to settle on one course of action, again, because there's so many possibilities, so many different courses of action. And they also have trouble not only focusing, but following through with projects and decisions, right? They will sort of change course midway. So they have a hard time finishing projects. They love to move their bodies. And as they become adults, they love to change jobs, relationships, hobbies, and even where they live. They tend to succumb to the idea or the whim that, moving is going to solve everything. Changing is going to solve everything, right? And that just exacerbates the condition. So it's important to recognize that in Ayurveda, since everyone has Vata in their constitution, if we didn't have Vata dosha in our constitution, we wouldn't move, we wouldn't be animated. So anyone's Vata can go out of balance. So even people who aren't born with a lot of these characteristics or a lot of Vata dosha can experience these symptoms if their Vata goes out of balance. And this could be caused from living a life that includes too many Vata qualities. So changing a lot, moving around a lot, moving the body too much, excessive exercise, right? Eating foods that are just like Vata, dry and light and cold. And so that means if you're eating a lot of salads all the time, raw food all the time, and dry food all the time, working too much, right? Doing too much, sounds like a lot of actually what our society and even our diet culture encourages us to do, right? So it's not surprising that this is, almost ADHD is almost sort of like an epidemic. And so just because someone doesn't look Vata, right, with those thinner bones, hair, skin, smaller features, maybe even lower body fat, it doesn't mean that they can't have this imbalance, right? So if you have a lot of these characteristics from birth, or you remember being like this as a kid, it will be something, ADHD or inattention, hyperactivity will be something that you will most likely struggle with throughout your life. You have more Vata, your Vata is more likely to go out of balance, right? You will always have to work on your Vata. If, on the other hand, you tend to be more in alignment with one of the other doshas, and those are Pitta and Kapha, which you can learn more about on my website, meganhayes.com, right? So if you tend to be more in alignment with one of or both of the other doshas, but you're experiencing Vata imbalance or ADHD symptoms, you will most likely be able to manage this a bit better and even a little more quickly, and that it's your lifestyle that needs changing, right? And probably your diet. You didn't come into the world with a lot of these tendencies necessarily. Whereas, again, someone with a lot of Vata will have to work on these things all the time. Someone with more Pitta and Kapha might just need to work on changing diet and lifestyle enough until the Vata is back in balance. Okay, so I just like to give us a little bit of Ayurvedic perspective first, so you can kind of see where we might be going with this. And then I want to look at ADHD from a Western perspective and sort of what is given in a treatment plan from maybe your mental health professionals or your physicians. And then we'll look at it from an Ayurvedic perspective. Okay, so hopefully you'll get some good comparison and contrasting and some really good ideas about how to help you or someone that you really care about with their ADHD, their inattention, and or hyperactivity. So let's look at the 3 ways that ADHD presents itself according to the CDC. Number 1, the first way is predominantly inattentive, presentation. So it's really hard for these individuals to organize or finish a task, to pay attention to details, or to follow instructions or conversations. The person is easily distracted and they forget details of daily routines. So inattentive, predominantly inattentive. And you can almost think like out of sight, out of mind in really severe cases. So if it's not right in someone's field of vision with a lot of this inattentive disorder, it doesn't exist. So that can be a really extreme example. And Ayurveda would say that this type of vata imbalance is more etheric in nature. There's more ether element, right? So there's more ether than there is air. It's a vata imbalance, but there's more ether than air. And ether tends to make people really spacey, kind of be out there in the clouds. And ether also diminishes the other elements. So ether in this case of a predominantly inattentive ADHD presentation, or really ADD presentation, is diminishing this person's capacity to focus. It's diminishing this person's capacity to get their head out of the clouds, right? To be grounded, so to speak. And then the second way that ADHD presents itself according to the CDC, so Western medicine, is predominantly hyperactive impulsive presentation. So that's the ADHD. The person fidgets and talks a lot of output. It's hard to sit still for a long time. So maybe for a meal or while doing homework or work, depending on if you're a child or adult, or maybe you're an adult in school. It's really tough to do your schoolwork or study. And smaller children may run or jump or climb just constantly. And the individual is going to feel more restless and have trouble with impulsivity. So someone who's impulsive may interrupt others a lot, grab things from people, or speak at inappropriate times. It's hard for this person to wait their turn or listen to directions. A person with impulsiveness may have more accidents and injuries than others. And Ayurveda would say that this type of vata imbalance is more airy in nature. So there's more air than ether here, So air is the only element that moves, just like we talked about, the wind, right? So individuals with more air element will have a harder time sitting still or being patient, So there's more movement involved. And then you could have the combined presentations, It's the third way, according to the CDC, according to Western medicine. So symptoms of the 2 types that I just talked about are equally present, the hyperactivity and the inattention. So the ether spaciness out there and the air, the mobility. So we'd see a predominance of both air and ether according to Ayurveda. And because these symptoms can change over time, the presentation may change over time. So how do experts and specialists test for ADHD? Well, there's no single test, right? In fact, symptoms often overlap with other conditions like anxiety, learning disabilities. So examples of learning disabilities that coincide with ADHD could be executive function disorder. That's become a more predominant health challenge. I've had more and more people come in with this to work with me through an Ayurvedic health counseling model. So executive function disorder makes it difficult for people to plan, to focus their attention, to remember instructions, and manage multiple tasks. And up to 90% of kids with ADHD struggle with executive function. And this is also something that's predominant in adults as well with ADHD. Another learning disorder could be oppositional disorder, also ODD. It's oppositional defiant disorder. And that presents symptoms that generally begin before a kid is about 8 years old. And that includes irritable mood, argumentative and defiant behavior, aggression, vindictiveness that lasts more than 6 months. So it's not just a phase, something that goes on for a while. And And there are many online self-tests you can take if you suspect you or someone else is suffering from ADHD. And here's an example of an online test for ADHD that has a subset of questions for hyperactivity. So it kind of distinguishes between inattention, ADD, and hyperactivity, the ADHD. And this will give you an idea of what symptoms come along with these health challenges. And let me share my screen here. And let's see. Okay. So here's an example of attention deficit disorder, ADHD test. Okay, so this is going to be a quiz that isn't diagnostic, but it's going to help you determine if you need to see someone to get a diagnosis and treatment. Okay, so it's asking you to just simply answer the questions on how you have behaved and felt during the past 6 months. And again, this is interesting because Ayurveda would say that, right, just because you're experiencing now doesn't mean you will continue to experience it. And it doesn't necessarily mean that you've always experienced it, right? So if you have a lot of Pitta and Kapha, this could be a Vata imbalance coming up for you, okay? Or maybe you've been really balanced, a really balanced Vata most of your life. And all of a sudden, circumstances, your environment, your lifestyle, even your diet changes dramatically. And some of these symptoms all of a sudden come up and you haven't had them before. So over the last 6 months, how often do you have difficulty keeping your attention while doing and completing something for work, school, a hobby, or fun activity? Right. So how often is it difficult for you to keep your attention focused? How easily distracted are you by something in your environment, like a noise or another conversation, right? So again, how hard is it for you to focus? And are there a lot of conditions around you having to, or you being able to focus? How often do you avoid or delay tasks or work that require a lot of mental effort or thought? So procrastination, that's a big one. How often do you have trouble listening to someone, even if they're speaking directly to you, right? Do you space out? How often do you have difficulty in organizing activity or task needing to get done? So again, kind of coming up with some of these executive function disorder. And how often do you make careless mistakes, right? How often do you forget to do something you do all the time, like missing an appointment, forgetting your lunch, right? How hard is it for you to be in a routine? You know, even if you have a routine around things, how often do you forget those routines? How often do you lose, misplace, or damage something that you need in order to get things done? So something that's really important to you. How often do you misplace your car keys, your glasses, right? And usually this is because there's just so much going on in the mind. And there's a lot of rushing. There's a lot of multitasking. How often do you have trouble completing your schoolwork or project, chores, responsibility once all the challenging or fun parts have been done, right? So when you've the thrill is gone, how often, are you able to stay focused and grounded and finish things, or do you space out again and go back and look for the new thing? And then these are specifically related to hyperactivity. Okay, so the ones above would be sort of symptoms that come up around the inattention or the ether, the kind of spacing out, zoning out. And then here we're looking at the air qualities. So how often do you feel fidgety, especially when sitting for long periods of time? How often do you feel difficulty waiting your turn, like talking in a conversation? Do you want to just jump right in? Do you want to interrupt all the time? And how often do you feel like you're on the go, right? Like you're driven by a motor, like you've just got so many things to do. You want to rush and you don't really there's no reason to rush, but that's a value for you. You value speed. You value quickness. I have some patients who come in and like, I don't know why I'm rushing. It just feels good. I'm not in a hurry. I'm not in a time crunch, but that's my nature. That's my impulse. So how often do you feel like you can't sit still, like you want to get out of your seat, especially when you're in a meeting or in a class, something that requires you to focus? How often do you begin to answer a question before it's done being asked? How often do you feel restless, like you want to get out and do something? I've got all this energy and I need to expend it. How often do you find it difficult to relax, unwind, and just be quiet with yourself, right? You always need something going in the background, some noise, the news, TV, music, right? It's really hard for you to be quiet and still, like just sitting and reading a book maybe. And how often do you find yourself talking too much, like you're dominating the conversation? And how often do you interrupt others or butt into conversations? Like maybe I don't know, you're in a grocery store and you hear two people talking and you gotta get in there. You gotta share your 2 cents. So that impulsive behavior, right? When maybe it's not so appropriate or it isn't warranted. Nobody asked you. So some of these things, I know I'm laughing about some of these things because sometimes the scenario is silly, but these are problems, right? And they present problems for people's work life, school life, home life, relationships, right? Friendships. And so these can be really problematic, especially when left untreated, right? So these are I wanted to bring this in because it shows you some kind of specific questions that professionals will ask and also gives you an idea of what some of these symptoms are, right? What people are looking for when they're diagnosing. All right, so let me stop my screen share here. All right, and let's get back to some of the causes and solutions from a Western perspective first, and then we'll look at what Ayurveda has to say about it. So what causes ADHD? It's not really known, but there are some theories with some basis in research findings. Okay, so one is genetics, that perhaps there's a familial tendency. People with ADHD are 4 times as likely to have a relative with the condition, and even more likely that you'll have ADHD if you have a first-degree relative who has it. And Ayurveda would say that this is our genes expressing themselves through the doshas, right? Or through our inherited tendencies. It could also be that there's a genetically based environmental tendency. Okay, so you have a tendency to express this behavior when you're in a certain environment. And also if you were exposed to environmental toxins in the womb, or those could be environmental, like I mentioned. So, everything from a contaminated water supply to, there's a lot of talk these days and theories about all the hormones in our water supply, the toxins in our water supply, right? And then also could be toxins like cigarette smoking, alcohol, drugs, or even nutritional deficiencies while in the womb, while in vitro, such as zinc, iodide. Low levels of iodide cause hypothyroidism, for the thyroid to function at a very low level, omega-3s, and iron. Okay, and these all can affect brain development while in the womb. So if your mother had delivery complications, like preterm birth, low birth weight, a breech delivery, or even a viral infection at birth, or an early injury to your prefrontal lobe, this would all affect brain development, theoretically. And again, these are theories that have been studied. And so these specific things like these specific nutritional deficiencies, specific delivery complications, right? They've been studied and have statistics around them, but nothing's really conclusive. So some MRI studies show that those with ADHD have thinner brain tissues around the areas of the brain related to attention. And so this eventually improves with age, and then the symptoms subside. So that's another theory, something that's been studied. Some studies will show that there are lower levels of brain dopamine, and this appears to be genetic. So low levels of dopamine is also related to other neurological diseases like Parkinson's disease, depression, and even restless leg syndrome. So nervous system disorders. Some studies showed that children with ADHD have a 3 to 4% smaller brain and or reduced white matter in the brain. And white matter helps transmit information. So again, these are all theories. And so that being said, one of the most preemptive steps to take is to make sure you have, to prevent this in your children, is to make sure you have as healthy of a pregnancy as possible. So no smoking, no drugs, no alcohol. It's pretty obvious, but then plenty of healthy foods in the diet so that you're getting enough zinc, iodine, iron, and omega-3 fatty acids. And we'll talk about how to get those from food at the end of our solutions when we get to the Ayurvedic part. And then how do we treat that when it presents? And many people use pharmaceuticals. Mostly these pharmaceuticals that treat ADHD are stimulants that can help with inattention, impulsivity, and hyperactivity temporarily, as long as the drug is in the system. They do have side effects, however, and that includes what you would imagine stimulants would create: difficulties with sleeping, irritability, so you get irritable as the drug wears off, and then decreased appetite. And that unfortunately increases ether element, right? That emptiness or vata dosha, which is the cause of these symptoms in the first place, right? It's the root of the problem. And then that can cause weight loss. Again, same, you're decreasing the tissues and increasing ether element when you lose weight. That increases vata dosha. So and because of that, in children, there could be a possible decrease in growth rates, possible tics or tremors that come up around the stimulants, and even potential heart problems if there is an underlying heart issue there. Okay, so you have to be careful. And then when the stimulants don't work, there are some selective norepinephrine uptake inhibitors, and these can help with the anxiety and social anxiety disorders that can come along with ADHD or present themselves with ADHD. These also have side effects, so they're kind of the opposite. They're more sedating, right? But they can also cause weight loss and loss of appetite, and then also increase risk of suicidal thinking. So those are some of the things that have come up side effect wise with selective norepinephrine uptake inhibitors. And then for children, there are many behavioral strategies that are quite effective and can also be brought into adulthood, right? So these are the non-pharmaceutical treatments here. So self-monitoring is a big one. You use timers or tones that are set randomly, like on your phone, to go off. And when they go off, the child writes down if they were on task or off task, and that gets tied into rewards. And these strategies are the most successful when the child is involved in creating them themselves, right? They're involved in the creation of them. And Ayurveda would say, yeah, of course, a vata brain, right? One that's always moving and likes to float off into the ether, perhaps, needs to be engaged. It needs to be grounded. It needs to be in the game, right? And so vata constitutions have immense amounts of creativity, and this gives their mind an outlet or a stage. Does that make sense? From an Ayurvedic perspective, even that this self-monitoring with rewards the kid is involved in, is motivating. Also identifying triggers that precede inattention and then form a strategy to deal with them in the moment, right? So if the phone goes off, or if there's a random noise, or, just if some sort of distraction comes up that is going to come up, you can create a strategy around, okay, this is what we do in the moment. Remember, the distraction is not going to trigger distraction necessarily. It's going to trigger your strategy, right? So, and this is really cognitive behavioral therapy, right? Is using strategies in the moment when the behavior is triggered, or the reaction, the neurological reaction is triggered. And you want to avoid criticism, but hold boundaries, right? So sort of like taking a non-judgmental approach to reward or consequence. You're not bad, you're not good, but this outcome is rewarded, and this outcome comes with other consequences, right? And then you want to teach self-rewards that motivate the child as well. So, positive self-talk, or things that they can reward themselves with, and they can take that into adulthood, right? So also creating a really calm, clean environment conducive to focusing. And many adults, I find, have taught themselves this, that everything has to be in order before engaging in work. It can be a form of procrastination, but it can also help with focus and eliminate unnecessary distractions, like an unclean house, or an unmade bed, or a disheveled desk, or an unorganized office. Also, routines. This is a big, big, big one. Routines need to be established around work and play and meals and sleep. And this is so important for all kids, not just ones that have inattention or hyperactivity. Good for adults too. Consequences need to be established and then enforced around getting off task, and again, without criticism or judgment. So that's a big one, right? You need to have consequences, and as an adult, have consequences for yourself too. Enforce them, but don't judge or criticize yourself, right? It happened, so this happens, moving on. We'll do better next time. We have another opportunity, right? And so what about adults? 30 to 70% of children carry their ADHD into adulthood. So up to 70% of kids with ADHD will carry those symptoms into adulthood. And studies show that adults with ADHD have greater difficulty with long-term relationships, and also with keeping jobs, and they have higher incidence of drug abuse. So it's really important to establish these habits in childhood if these symptoms present, and then also to start working on them as soon as you start to see them, if they arise for the first time in adulthood, or perhaps they come back in adulthood. So some of the strategies for adults are basically grown-up versions of these childhood strategies, like keeping a to-do list and a planning calendar and then using it. That's the big one, right? You got to write down stuff and then go look at it. Put stuff in your calendar and use your calendar. So those are important. Use voice memos on your phone to record things, right? That you need to remember, or ideas you have. So they're not just swimming around in your head, taking up room and space and energy and time and your personal power. Put them into a voice memo. But this is contingent, again, like the to-do list and the calendar, is contingent on that you actually remember and sort of remind yourself or schedule into your daily time to review and organize these voice memos, right? So do something with them. Make sure they're not just all swimming around on your phone also. So you want to build it into your day that, okay, at 4 o'clock, I review all my voice memos, or you set a timer on your phone that says review voice memos at 4 o'clock, right? And it catches your attention, it triggers a behavior, and over time, again and again and again, it creates a habit, right? And a really effective habit, because then you are really being productive by taking the thoughts that come up, recording them, and then putting them onto paper, organizing them, putting them on your to-do list, putting them on your calendar, okay? And then you want to add structure and routine into your life around sleep, meals, work, and play and rest, just like kids. Get your living and office or working space organized, right? And this includes your car even, right? Make sure that your space is an extension of how you want your mind to be: clear, focused, organized, okay? If your space is not, the surroundings, your environment isn't that way, your mind won't be either, okay? And build time into your day, each day, to tidy up or straighten up, right? If you let it go too long, it becomes chaos. But if you do a little bit every day, it stays that way. So set a timer at, a couple of times a day where you straighten up. You take a break from work and you straighten up your office. You listen to those voice memos. You organize your to-do list, right? And then check out counseling to deal with any frustrations or perceived failures in work and or relationships, right? So dealing with the emotional aspect of how this affects your life. Really, really helpful. And then perhaps some social skills classes would be helpful if you find yourself in that hyperactivity vein where you're interrupting people or having a hard time listening, or even engaging in sort of socially acceptable conversational skills, or even taking some communication or public speaking classes if that's a part of your job, or something you want to hone in on, is being able to express yourself more clearly and concisely. Also, give yourself more time. The typical ADHD student requires 3 times more study time than the average student, right? And this translates into work life as well. So don't procrastinate. Do small blocks of work at the same time each day, well before the deadline. So schedule it in there and tell yourself it's just 45 minutes. 45 minutes is a good place to start, because most humans can't really focus for longer than this, even if you don't have ADHD. 45, 50 minutes is about the sweet spot for most people. And if you're really struggling with inattention, hyperactivity, start with 20. If you have to, start with 10, right? You can actually get quite a bit done in small increments. Okay. And I know it doesn't seem like a lot. Chances are you'll want to keep going. Once you start, it's starting that is so hard for so many people. There's a lot of anxiety around starting, and procrastination is a way to deal with that. So if you divide it into little chunks, then you will feel so much better and be so much more prepared and organized and calm. If you work on things in small increments, it will actually reduce your anxiety around the work. So don't procrastinate. Work in small chunks throughout the day. Schedule it, set timers. The phone is pretty amazing. I mean, it's got so many tools that are useful for managing attention deficit and hyperactivity disorders. So let's talk now, let's switch gears and talk about ADHD from an Ayurvedic perspective. Okay, so we always kind of have to talk about the spiritual side of things. Ayurveda is not a religion, but it does involve spirituality and connecting with your higher self, your soul, the divine, gravity, love, whatever you want to call it, whatever sort of fits into your wheelhouse, your structure, right? But karma is involved. So cause and effect, the agreements you made maybe as a soul before you were conceived and the lessons you came into this existence to learn. So if you have these symptoms, right, you can think of it, perhaps you are here to learn how to focus, to learn how to cultivate patience or commitment. So there's a reason. There's a reason. And sometimes that helps make sense of things. Sometimes that helps create faith in something larger than ourselves. So I just like to bring that up. And if you're uncomfortable with that, it's okay. There are so many other ways to manage your ADHD from an Ayurvedic perspective, and to alleviate and heal. It's just, I like to bring this up because cultivating faith in something greater than ourselves, again, whether it's just the force that holds the universe together, or something specifically divine, it's super helpful. That's sort of the overarching highest practice for somebody with this kind of a vata imbalance, is to cultivate faith in something greater than ourselves, to know that there's a purpose and a reason behind this, and maybe even just to create your own reason around it, right? I'm here to cultivate more patience, commitment to being here, and to learn how to focus and find more compassion for others and myself. Okay, so also, as I mentioned before, from a Western perspective, genetics are involved, right? As well as your time in the womb and your mother's diet and lifestyle while you were in the womb, right? So this is really similar to what we've already talked about from the Western perspective. And so to prevent a vata imbalance at birth or in the early years, the mother should lean toward a diet while pregnant that is rich in heavier foods and really nourishing foods, like cow's milk is a big one. If you're vegan, there are many, milk alternatives out there. Oat milk is a really nourishing one. Ghee or clarified butter, whole grains, cooked vegetables, especially root vegetables, and well-seasoned food so that the mother's digestive system can break down, assimilate, and form healthy tissues from these foods, right? And culinary herbs like cumin, ginger, cardamom, and a little salt are all very helpful in breaking down these heavy foods, as salt specifically draws moisture to the tissues of the body. So if the mother has a lot of vata and dryness, coldness, lightness, instability, then this will help create a better environment for her fetus, right? It'll help draw moisture to the tissues, and then the cumin, the ginger, the cardamom, those spices, culinary spices and herbs will help break down the food so that it can create proper tissue for the fetus and also for the mother. From an Ayurvedic perspective, there are actually 3 types of ADHD presentation. They're a little different from the ones we talked about. The first 2 are similar. Okay, so this will sound familiar. The first type is an ether presentation. Okay, and that's the distraction without the excessive activity, without the hyperactivity, without the excessive air element, okay? And so that presents like distracted and spacey, difficulty focusing, poor memory, and that's more of like an ADD, okay? Attention deficit disorder. And then we have the second type of presentation, and that's the air, okay, more air elements. So that's the excessive activity, the movement, which leads to distraction, okay? So this would actually end up being a combination of air and ether. Okay, so really, if you have hyperactivity, you're also going to have the inattention, okay, because the hyperactivity leads to inattention. So that's the distraction with the excessive movement, hard to sit still. There might be some recklessness or like daredevil tendencies, that impulsiveness, excessive talking, interrupting, blurting, right? And there might even be physical tics or tremors, anxiety, OCD, and possibly some insomnia as well. And so this is characterized as ADHD, right? You've got the inattention and the hyperactivity. So we've got ether presentation, which is just the really distracted and attentive. It doesn't have all that movement though, that hyperactivity. And then we have air, and that leads to all the movement, and that leads to the inattention or the kind of getting unfocused and spacey. And then this is interesting. Ayurveda says there's also an earth presentation, and earth The earth element makes up kapha dosha. Kapha dosha, unlike vata, is slow, heavy, and stable, and has a lot of innate moisture because of the water element that also makes up kapha. Kapha is made of earth and water. So in this case, there's an obstruction to receiving the information. There's a blockage. There's too much earth, too much dullness, too much heaviness, maybe too much tissue, maybe too much even water element, right? So it's blocking the information that's supposed to be coming in but isn't. And so the person appears inattentive. They listen, but they don't act. They may not follow directions. They have a poor understanding of what you're asking them to do. They're slow to process. There's a dull quality to the mind. And there's no motivation. Even their body is very sluggish. And it's not true ADD, ADHD, but it is a seemingly way of inattention presenting itself. Okay, so I like to bring this up because you might be feeling like you can't focus, you can't act on things, you can't process information. And sometimes it can present like ADD or inattention, but really from an Ayurvedic perspective, it needs a completely different treatment plan, which we'll talk about. Okay. And so again, this is going to be accompanied by lack of motivation, a lot of sluggishness, dull mind, and not being able to process information because there's slowness. There's a blockage. And then also the defiant behavior, the ODD, the oppositional defiant disorder that I mentioned, from an Ayurvedic perspective, this is going to develop when fire, and that's in the Pitta dosha. Okay, that's anger and heat. That mixes with the Vata. So this would be consistent with something we call like pushing. So when Vata pushes Pitta, you can think of that as the air fanning the flames of a fire and turning it into a conflagration. So there are these angry, defiant outbursts. So this could be someone with a lot of both Vata and Pitta in their constitution. Someone with a lot of Pitta who now has a Vata imbalance, and then that Vata pushes the Pitta even more. Or someone with a lot of Vata, and that Vata eventually pushes Pitta out of balance as a secondary symptom. Okay. So I like to bring that up for any practitioners that are listening, right? You can kind of look at these different patterns, and it will help you see what doshas are out of balance based on the symptoms. And that will help you devise a treatment plan for your client or for your patient. So here are the causes of each. And we talked a little bit about this already, but the ether type, and this is like the dreamer, right? The ether type, ADD, is the mother or the person with the imbalance. And I say mother because if this creates some of these symptoms from childhood, right? If we're looking at possible deficiencies in the diet or toxins coming in during pregnancy that are creating these things in the child, then we want to talk about pregnancy as well, that gestational period. So the mother or the person with the imbalance, the child or the adult with the imbalance, is fasting or skipping meals, right? Creating that emptiness in their body, more ether, more vata. They're eating cold or raw foods, right? So again, like salads, smoothies, dry food, a lot of crackers, granola, popcorn. They have a lack of routine around their meals, around their sleep, and or their work or play. There's just a lack of routine, right? So all over the place, lots of space between stuff, right? A lot of ether, a lot of vata. Or there's encouragement of that dreaminess, right? With a lot of fantasy novels, or even a lot of marijuana usage, right? You're smoking a lot of pot. It's putting you out there into the ether. Okay, so whether it's the mother and this is affecting the fetus and then the child as he or she develops, or the child develops, or if this is the person with the symptoms and these are their activities, or these are their lack of sort of routine or balance. So that's the ether type, creating a lot of space. Okay, then the air type, the mover, right? The hyperactivity. It's all of the above, right? So they're fasting or skipping meals, they're eating cold and raw food. There's a lack of routine around everything, meals, sleep, work, play. But also it could be that there's a lot of Whereas with the dreamer, the ether, there's a lot of like fantasy and right imagination, sort of encouragement of that. Maybe the person with the hyperactivity is using a lot of stimulants, and that could just be coffee, right? Or caffeine and sugar, right? So we are drawn to, Ayurveda tells us we're drawn to what keeps us out of balance. So, right, we like our mania. So they like that high that they're getting from the coffee all day, or the sugar, right? The rush. Or there's, lots of sensory stimulation, like video games, TV, going to concerts all the time, theme parks, right? Places or activities with a lot of visual, audio, and sensory stimulation, right? They love that. And that's what's going to keep them out of balance. Okay. So a lot of stimulation, either from substances or environment. Okay. And then the earth type that we talked about, the slug, right? There's too much, it's all the opposite. There's too much heavy food. There's too much dull food, right? A lot of processed food, junk food, even leftovers or canned food, a lot of lack of movement, right? So too much stillness, not enough exercise, or maybe even just too much reading, right? There's too much stillness, too much sort of bookwormishness, and lack of stimulation, right? So not enough visual, audio, or oral stimulation, sensory stimulation, even touch, lack of touch could create that. So how does Ayurveda say to manage these? And we'll go through each type, okay? So the etheric type and the air type, really we're going to have, because they're both vata imbalances, the ether and the air. So the ADD and or the ADHD. Let's look at how we treat either of those. Okay, or both of those. So they have similar treatment plans. And the first thing is routine, 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 right? We want to ground the nervous system and keep that vata in the world and out of the clouds. And this is helpful in keeping any anxiety at bay as well. So if you keep your routine, your body knows what's coming. Your nervous system can relax out of that fight or flight, that sympathetic nervous system mode all the time. And your anticipation of, or in its anticipation of change or irregularity, and drop into that more relaxed state more of the time, right? The rest and digest, the parasympathetic nervous system. So if you get into that routine, your body and your mind knows what's coming. And that really helps calm the nervous system down and reduce anxiety greatly, if not completely. Also, we want to keep the body full. So you don't want to skip meals. Eat at regular times, pay attention to your hunger. Do not ignore your bodily urges. I often have my clients with a lot of ether or a lot of air, right? A vata imbalance, a lot of inattention as well, right? When it's out of sight, out of mind, set timers to remind them to check on their bodily functions, right? Even to remember to pee. I mean, if you ignore your urges, even elimination, if you ignore these over time, again and again and again, it can lead to very difficult to treat constipation, right? And even pelvic floor disorders. So the more you ignore, the more tired the body gets at trying to remind you. It just sort of gives up and stops eventually. So it's so important that you really take a moment every, hour, every 2 hours even, to stop, scan your body and say, okay, when's the last time I had some water? When's the last time I went to pee? When's the last time I ate? When's the last time I got up and walked around a little bit? When's the last time I stopped and rested? Okay. So really, really important here. We're just trying to tune in and get back into the body, get more earth element, right? And ground the ether and the air. And then your digestive fire, also called Agni, your Agni in Ayurveda, or your metabolism, can be very variable, be quite variable with that air and ether element. So to stabilize digestion, the nervous system, right? Because we want it to know what's coming, and also to ground and fuel the mind, you want to eat smaller, more frequent meals that are cooked. So we bring in warmth, moist. So they're like cooked in ghee or healthy oils, and a bit on the heavier side. And that heavy includes like grains, root vegetables, nuts and nut butters, some meats, healthy fats. And they need to be well seasoned to help you assimilate and digest the food, right? So again, ginger, cumin, cardamom, a little salt. It's going to help draw moisture to what are usually drier tissues in the digestive tract, those mucous membranes. So Aim for soups, stews, curries, stir fries versus salads, sandwiches, right? Popcorn, chips. So we want things that are cooked, nourishing, heavy, but well seasoned so you can break them down. Okay. And then you want to eat, like I mentioned, a little more frequently. So like maybe 5 times a day, 3 meals, 2 snacks. So the meals can be a little on the smaller side so that you don't overwhelm your digestive fire. You don't put it out. So a little on the smaller side, and then you're going to be hungry a little more often. And also, hopefully, you're going to be setting that timer and paying attention to your hunger cues and then developing routines, right? So really, you can do all of these things just starting around diet. So huge. And Ayurveda would say that's where all imbalance or health begins anyway, is in the digestive tract. So that's really where we want to start. And then it kind of is obvious, but avoid smoking. Avoid smoking anything, even marijuana. Smoke from marijuana dries out the body and the mind even further. And Vata is already dry. So this just enhances the irregular digestion and then thoughts, irregular thoughts, circulating thoughts, and anxiety, right? So avoid the drying practices, especially smoking anything. And then you want to use your creativity, but with activities that require more earth element. Okay, literally more earth or dirt. So gardening is fantastic as a balm or a healing practice for that air and ether. Working with rocks in some way, or crystals, physical labor, okay, like physical, maybe outdoor projects. Weightlifting is a great practice for all that air and ether. It's very grounding, heavy, slower. Pottery, right? You're directly dealing with earth and water, mud, the clay. Carpentry, woodworking. So, things that are stable and solid. And this is really easy when just walking in nature. There's so much earth element outdoors. So walking in nature is huge. You like to hike, start hiking. And then you also want to apply warm sesame or almond oil to the body before or after a shower. So before a shower, you're going to put the oil on and then get in a warm bath or a warm shower. It opens up the pores. The oil can soak in. It rinses off any excess. You use as little soap as possible and then just pat dry after. So you leave a little bit of oil, a protective barrier on your skin. And this helps ground the nervous system, the actual massage itself. It's wonderful for all systems of the body. It also helps increase bone density, keeps our muscles and our joints healthy. And specifically for this ether and air element that comes up with ADD and ADHD, the inattention and the hyperactivity, or one or the other, you want to apply the oil in a downward motion. So start from your head and work all the way down to your feet. Okay. So that's going to help ground. And this practice is called Abhyanga. And if you want more information about it, just shoot me an email and I will send you more info. And then also in meditation, you want to focus your attention on your seat or your feet. Okay, so the things that are physically attached to the earth while you're seated in meditation, either through the floor you're seated on or through the chair you're seated on, or focus on your feet, the things that anchor you to the earth when you're standing and moving around in the world. Okay, so focus the attention on the seat or feet. And then yoga asana, right? So if you're practicing yoga, you want to do standing or seated poses. Again, that require you to root yourself to the earth. So no inversions, no handstands, right? No wheel pose, right? You want your head to stay above or level with your heart. So maybe down dog a little bit is okay because you've got all 4 limbs anchored to the earth. But especially for that, that ether element and that air element, we want to make sure that you're not turning your world upside down, right? We want to get you grounded instead. So you need to circulate. You do need to circulate, especially if you have a lot of hyperactivity. You just don't want to do it quickly, right? So walking is better than running. Slow flow yoga is better than quick flow yoga, right? And maybe another example would be you work out at the same times every day, but maybe you change, what type of workout you're doing. So one day you do weightlifting and the other day you do a slow flow yoga asana class and another day you're hiking out in nature, right? That's very helpful. Vata needs to feel like it can be creative within boundaries. Okay. So you can change it up, but do it at the same time every day. Another example might be work, work at the same times every day, but maybe you change where you work. If you need some variety, right? So if you work from home, you could change the room you work in. You could change, if you want to go to a coffee shop, if it's not too distracting, right? You might go to a different library every day or a different outdoor space every day. Again, you don't want it to be too distracting because we're dealing with hyperactivity and inattention, but you want to give yourself some variety if that's what helps you feel more creative, right? But within boundaries. So you do the work at the same time every day, but maybe in a different place. So these are just some examples, right, of how you can allow that air to circulate, but keep boundaries around it. Okay. And then color chromotherapy is quite helpful. And you want to use the color brown, the color of earth, right? It's grounding, and earth tones. So anything with brown in it. So earth tones are quite helpful. And gold builds your immune system. And you want to use these colors in your clothing. So more earth tones on your body and your decor. Maybe you change out your accessories or paint colors, bring in flowers and plants. That's an easy way to do it. And get your hands in the dirt, while you're taking care of those plants. And maybe through art. Art is a really lovely way, either creating it or purchasing art that helps bring more grounding and building into your day. Also, especially for the ether type of ADD, the inattention, where you get spacey, you want to avoid or reduce things that we talked about that tend to exacerbate the ether element, like fantasy books and games, abstract art, right? It's kind of whimsy. Make sure it's like a photo or a painting of something solid, right? Like a desert landscape would be lovely. Those earth tones there, and it's tangible. It's something in nature that you can touch and feel. And you want to get your body into the present moment and get yourself into your body with very deliberate movement. Okay, so again, the yoga, the gardening, the weightlifting, all really, really good for the ether. And it's still movement, so it's good for the air, but it's slower movement. It's more deliberate movement, okay? And then especially for the air, the ADHD, the hyperactivity, you've got to stop multitasking. You've got to reduce your to-do lists, and you've got to slow down in general. We've talked about some of these things, but they are so important, that the multitasking, the gobs of things on your to-do list, and how fast you're moving. Slow down. If you have too much on your plate, you will always be rushing. You'll always be making mistakes and feeling like you're failing or letting people down. And so look at your to-do list. And this is what I tell people to do, and this is what I have to do with myself. Whatever has been on your to-do list for more than 2 weeks and is not done, let it go. Unless you're going to lose your job, but if it's something personal or something kind of not that important, it's obviously not important enough, or you would have done it already, right? Or you obviously don't have time, or it would have already happened. So trust that it will come back when you're ready, when you have more time, when it can be a priority. But if there's anything on your to-do list, even if it's more than a week old and you still haven't done it, take it off. It obviously isn't imperative, right? It's not crucial. Let it go. So do a lot more editing with your to-do list and what you're expecting of yourself, and do it gradually. When you start doing it, it's going to be easier to do it again and again and again. And you'll start realizing, wow, I have been wasting a lot of mental energy with all the things I think I need to do or should do, right? That you're shoulding on yourself. So let go of your to-do list, your tasks, and you'll have more time. You won't need to rush. And if you catch yourself more and more when you are rushing, you can ask yourself, what is the point of this? I'm just creating more imbalance. So I need to slow down. Take a deep breath. Slow it down, right? What's the value in rushing? There isn't any. And in fact, it's making your condition worse. Okay, so let's finish off with the earth type of ADD. And as you can imagine, they need exactly the opposite. Okay, so they need to change it up. They need to be spontaneous. So anything that these people are doing over and over again, right? They need to do the opposite or do it differently, right? We want to stimulate their nervous system and their senses. Okay. So also, they don't need to stay full all the time and eat all these meals. They need to fast once a week, maybe, to help keep the body lighter. Coffee and tea during that fast would be fine. Coffee and tea are too stimulating for true ADHD with the air, right? And even the ether. But for somebody who's got a block and the information's not coming in, and there's dullness and there's lack of motivation, the caffeine can be a good thing. right? And then you might even try daily fasting. So eating your first meal around 11, right? Kind of like an early lunch or brunch. And then your next and only other meal around 4. And then you fast again until around 11 o'clock. And these are all things that balance kapha dosha. Kapha dosha made of earth and water. Okay. So also your agni, your digestive fire, your metabolism can be low. So you need to eat foods that lighten you up. So all the foods that Vata is not supposed to have, right? All the foods that the air and ether type of ADHD is not supposed to have. The earth ADD or the earth kind of blockage, right? They need the lighter foods. So like quinoa, corn and corn products like popcorn, corn flour, corn tortillas, corn chips are fried, too oily and too heavy. Okay. But the other corn products, tofu, soy, raw leafy vegetables, they get to eat the raw, the light, the bitter, the cold foods. Okay. Because they need to stimulate their digestion and dry up excess secretions. They need to unblock things, right? Some dried fruit is okay. And then again, popcorn, if you need a snack. Food should be very well seasoned and even really spicy. Okay. So the hot herbs and seasonings are okay, like pepper or peppers, Tabasco, sriracha, lots of ginger, spicy mustards, all these things that heat up and stimulate. Okay. And might even cause some sweating. They need to get moving with vigorous exercise, right? So whereas the ether and air type of ADHD, the hyperactivity and inattention, is going to need the slow flow and the grounding poses, they're going to need quick flow. The earth people, they're going to need quick flow, hot yoga, right? They're going to be okay doing inversions. They can turn their world upside down. They need that stimulation. They need to stimulate the nervous system, and that actually helps stimulate the thyroid as well, and they need to go jogging instead of walking. Okay. They need to do a vigorous hike if they're going to do anything. So it's all the opposite. Okay. Because this is technically a kapha imbalance. There is a blockage, and we have got to unblock things. Got to get things moving. They need to find what inspires them to act. So maybe it's service or volunteering. Maybe it's art. Maybe it's a club. Maybe it's music. Maybe it's dancing, right? They need to find something that inspires them, okay, that wakes them up. And then instead of putting oil on the body, which is very heavy and grounding, they need to dry brush their body. Okay, with just a little body brush, and they want to do it maybe once or twice a week, and that helps stimulate the lymphatic and circulatory systems. And they want to move upward instead of downward. Okay, so the Vata and ether types of ADHD, they need to put oil on to make them feel heavy and grounded in their body, and they need to move from head to toe with that oil, with that massage. Well, the earth ADD, the earth blocked, right? Blocked flow inward of information, inability to process, inability to understand, the dullness, the heaviness, the lack of motivation. We need stimulation. So we're going to brush from the feet up and from the fingers toward the heart. Okay. So we want to stimulate things and shake it up, stimulate the nervous system, stimulate the mind, unblock things. In their meditation, they need to focus their attention on the neck and head, right up here on the lighter things, the throat and the third eye. They want to focus on the upper extremities to move energy upward versus moving energy downward and grounding and connecting with the earth. They've got too much earth. So we want to lighten them up, focus up here when they meditate. Their colors, their chromotherapy is going to involve light colors. So white, very lightening, red, super hot and stimulating. Orange and yellow are also heating and uplifting, right? So yellow is just such a nice mood enhancer. They need to avoid brown. They already have enough earth, okay? And so again, they want to bring the light, hot, stimulating colors into their clothing, their decor, their art, their flowers, their plants, etc. Okay. And then as far as sleep goes, they need to get a little less sleep. So they shouldn't be sleeping in or staying in bed too long. 7 hours should do it. Okay. And then they want to avoid sitting for too long. So too much reading, too much computer or video games even, right? It's stimulating, but there's too much lack of movement. There's too much sitting going on. And then they need to get more sensory stimulation. So if they're comfortable with it, they need to go to concerts, amusement parks, art galleries. That would be a great way to do it. And they don't have to, interact with too many other people or even talk to anybody. Art galleries are a great way to get in visual stimulation, as well as listening to fun music that inspires them to move their body and get up and dance, right? So This is the complete opposite of what the air and the ether, the traditional ADHD needs. Okay. This is specifically for those who feel dull, heavy, lack of motivation, and like they just can't process information properly, right? They're hearing it and there's nothing happening with it. Okay. Also, I wanted to touch on aromatherapy. And there's some theory that, your smell receptors in the nose communicate with parts of your brain, possibly your amygdala and your hippocampus, affect those particular parts of the brain. The amygdala and the hippocampus affect memory, so helping with memory recall. And there are also theories that the molecules from the essential oils, they're in the aroma, enter the bloodstream through the capillaries in the nose, and they interact with hormones and enzymes in the body, okay, to affect your focus or your stimulation or your memory recall. And so those with a lot of air element rather, so the hyperactive individuals, we want to bring in essential oils that sharpen, clear, and stimulate the mind and help reduce depression and help increase focus. And some of those are basil, mint, sage, bay, like bay leaves, camphor, clove, eucalyptus, and myrrh. Okay. And then the aromas or the essential oils that help balance the mind in the case of anxiety and depression, right? So these are things that come along with ADHD, anxiety and depression. And so the aromatherapy you'll want to focus on, or the scents or essential oils you want to focus on for anxiety and depression, are vetiver, cardamom, cedar, frankincense, chamomile, clary sage, and geranium. Okay, all help with anxiety and depression. And then we have those who are very high in their ether, right? They don't have a lot of hyperactivity. In fact, if there's hyperactivity, you want to avoid these, okay? So we're just talking about the ether people who get spaced out, but they're not moving around too much, okay? And this could also help with the earth types. It could help kind of awaken their senses. Rose, jasmine, lang-a-lang, and that's the one that's spelled really funny, Y-L-A-N-G, lang-a-lang, honeysuckle, and gardenia. And so these are all the flowers, and they really help with the high ether, for the inattention, but not the hyperactivity. So if there's hyperactivity, you want to avoid these flowers. And if there's earth, if there's that dullness, these will help lighten things up. Okay. And then there are also some Ayurvedic herbs to be considered for ADHD. So for the high ether individuals with the inattention, we can bring in ashwagandha, and we can bring in some demulcents, things that enhance the moisture in the tissues and in the digestive tract, slippery elm and licorice. Okay. Then for the air individuals, so for a lot of hyperactivity, we can also bring in ashwagandha. And then another nervine tonic, or something that strengthens the nervous system and calms everybody down, is Shanka Pushpi. Shanka Pushpi. And then for the earth people, they need that stimulation and that heat. So Brahmi, either the Brahmi can be used to refer to the herb Bacopa or Gotukola, either one. Okay, they're a little lighter, but they're good for the nervous system. Bayberry and clove, they're all stimulating and lightening, and really good for the mind, clearing blockages in the mind. Also, St. John's wort can help with depression associated with that heavy earth imbalance. Okay. And then you could take these herbs orally, like in a capsule or in a tea. But if you can find a nastia oil, okay, or if you're working with an Ayurvedic practitioner who can make you one, I make medicated oils for my patients. A nastia oil, it goes into the nose. It's an oil that you put just a couple of drops in each nostril, and you massage it into the sinuses. You want to do it on a decline, right? So like hang your head over the edge of the bed or the back of the couch, and you just sit there and let it absorb. And the ancient rishis somehow knew that there's no blood-brain barrier right at the olfactory bulb. Okay, so literally the qualities of those herbs that have been cooked into the oil can go right to the brain, right to the nervous system, right to the mind. Pretty amazing. And that's where we want to direct these herbs. Okay. So if they go through the digestive system, it just takes a little longer to get there, but it will help build the nervous system and help with the mind. It's just the nasya is a direct way to do it. And then you don't have any, you're not working through the digestive system. It's just more efficient, but it's also quite subtle. All right. And then nutrition, we talked about that. You want to look up how much of these things, how much of these nutrients you should get for your age, your sex, and your weight, and if applicable, while you're pregnant. And one is zinc. We mentioned that this has been associated, lower levels have been associated with increased incidence of ADHD. And you can get zinc from red meat, from poultry, from beans, nuts, whole grains, and also dairy products. And then iodine, which helps regulate and stimulate thyroid function. Okay, you get that from seaweed, seafood, dairy, eggs, and beef liver. Iron, you get also from meat, dark leafy greens like spinach, also from dried fruits like raisins and apricots are quite high in iron, peas, and iron fortified cereals and grains. And then finally, omega-3 fatty acids. Okay, so you want to get that from wild caught cold water fish, not farm raised. You can also get it from plant sources, ground flaxseed. You've got to grind the flaxseed for your body to be able to absorb. Hemp seeds, chia seeds, hopefully you soak those, okay, so you can digest them. And then also walnuts are a source of omega-3 fatty acids. And then finally, there is a meditation that I want to show you called Yoni Mudra, or it's really a mudra or a hand position. Mudra means seal in Sanskrit. It's like a seal with your hands. And you use it to help you focus. And I've been talking for a while, help you focus and calm the senses. Okay. So what you're going to do is sit in a comfortable position, either on the floor or propped up or even in a chair. And then you want to keep the body above the waist very straight and the body below the waist very relaxed. You'll close your eyes, and you can do this with me. You're going to place your thumbs by the ears. Okay, right here. You can even cover your ears if you want. And then your index fingers rest gently on the eyelids, so kind of on your eyelashes. And then you place the middle fingers on the nostrils. You don't close your nostrils, but place them near them, or just, rest them on them without occluding. And then the ring fingers go above the lips and the pinkies go below. Okay, so just like this. And then you let your elbows come up to about shoulder level, right? And you are identifying each of the senses: hearing, seeing, smelling, tasting, and then also you're touching your skin, so feeling. You close the eyes and bring the breathing in and out through the nose very gently, very easily. And you hold this position while you focus on the breath or on the sensations of your fingers. And when your mind wanders, you bring it back to the sensations on your fingers, the sensations in your body, and your breath. This is a beautiful meditation to help enhance focus, to help the mind to withdraw from the senses and change your perception, bring in clarity, peace, and harmony. So start with just maybe 1 minute, especially if your ADHD or inattention or hyperactivity is quite severe. Start with 1 minute and add on a minute each week or even each month, right? Just do 1 minute a day, every day. These small changes can have profound effects. And all of these subtle things, the aromatherapy, the meditation, the color therapy, are much more subtle, right? So the things you really want to focus on first are diet and lifestyle, routines. Okay, so these are the big things. Your activity level, right? Your level of output or input, depending on if you're working with the air and ether imbalance or the earth imbalance, right? It's super, super important to start small. You want to take one practice or one focus each week, or again, even every other week or once a month, you add something new. If you do too much at once, you're going to overwhelm the vata, too much air, or you're going to discourage kapha. Okay. They just don't have the drive to do that much. So you want to wait to bring in anything new or increase like the length of your meditation until it feels like it's a part of your life. Right? So be really patient with yourself. Use this newfound information to cultivate compassion and kindness to yourself and to others. And let me know if I can help. I have many inspiring stories around clients who have overcome their inattention and hyperactivity with really simple, yet again, profound Ayurvedic diet and lifestyle strategies. And I'd love to help you formulate a healing plan, a treatment plan for yourself. So please let me know if you have any questions. You can email me at megan@meganhayes.com. You can check out my website, meganhayes.com, to find out more about Ayurveda. And please just let me know if I can be of service. Thank you so much for joining me today. I hope you have gleaned a lot of tools and knowledge and wisdom to help yourself or even a loved one or a friend. And hopefully I will see you next time. So have a wonderful rest of your day. Thank you so much again for watching. I appreciate you so much. I'll see you next time. Bye-bye.